Hello, good evening everyone. I am Dr. Preetam S. Hurkadli. I am a consultant gastroenterologist and hepatologist practicing at Hurkadli, Karnataka. Basically, this video has been made to educate the common people regarding viral hepatitis. So what do you mean by viral hepatitis? In fact, what is hepatitis? Basically, hepatitis is a Latin word which was derived from the Latin language, and it means that inflammation of the liver. Basically, what happens is the liver is studded with inflammatory cells, and these inflammatory cells try to destroy the hepatocytes. Hepatocytes, by meaning they are the cells of the liver, and they destroy the liver cells. So what is hepatitis? Basically, it's not a disease, it's a condition. As with other disease, fever is not a disease, it's a symptom. Similarly, hepatitis is a symptom, it's not a condition. So what are the things around us which can cause hepatitis? Basically, can be divided into viral hepatitis and non-viral hepatitis. The common viruses which can cause hepatitis again can be divided into 5 types of hepatitis, that is hepatitis A, hepatitis B, hepatitis C, hepatitis D and hepatitis E. What are the non-viral causes of viral hepatitis? The number one being the alcohol, the most common and most widely available thing around us. The second one, the medications. There are certain medications, certain drugs what we take that also can cause hepatitis. Other certain things are like congenital ones which can be inherited from your ancestors, and the most and rare one, something known as autoimmune. So I discuss one by one of these hepatitis. So moving to the viral hepatitis again can be divided into acute hepatitis and chronic hepatitis. Acute hepatitis, hepatitis A, hepatitis E can cause acute hepatitis. That is, they do not stay with you for lifelong. They come, they infect you and they get cured. But there are certain viruses, there are certain viral hepatitis such as hepatitis B, C and D. These 3 things can cause chronic hepatitis. That is, once they infect a person, they permanently stay in your body and can be there for prolonged duration until otherwise you take a proper treatment for this. So how does this viral hepatitis come to us? What are the causes? Basically, I will be discussing one by one. Let me begin with acute hepatitis. I mean to say acute hepatitis caused by hepatitis A, hepatitis E. These 2 can cause acute hepatitis. So how do these acquire? How do these come to us? Basically, hepatitis A and E spread something known as fecal-oral route. That is, by eating unclean foods. A person who is infected with hepatitis A or E can infect others through his stools. Normally, what we eat outside, in the roadsides, there are the potential places from where we can get acute hepatitis A or E. Acute hepatitis E is present throughout India, whereas acute hepatitis E is predominantly seen in northern parts of India. So how is this symptoms? What are the symptoms by which we can detect hepatitis A or E? Basically, patient has fatigue. Fatigue, I mean to say, patient has extreme weakness, he has fever, he is not able to do his routine daily activities, and of late, after 1 week or so of these symptoms, patient gets jaundiced. The other symptoms what patient can have is vomiting and extreme tiredness. Patient also can have jaundice. Moving further, how do we treat these patients? What is the patients need to do with these hepatitis A and E? The basic treatment is absolute bed rest. Avoid oily foods. Take adequate liquids, that is, he or she has to take a lot of fluids through mouth, and take absolute bed rest. Majority of the patients will recover by this treatment. But there are certain patients who do not recover with these with this treatment, especially those who are infected in a high dose. Patients will require Certain patients will not require promptly with these medications or the treatment, they will require additional support with additional supportive liver care. But there are certain patients who can become comatose. They can bleed from all the sides. They are the patients who will require liver transplantation, that is complete changing of the liver. But that is very rare. Majority of these patients recover promptly. So how do you prevent? How do we prevent? How do we escape from getting these infections of hepatitis A and E? Basically, you need to wash your hands before you eat. Don't eat at places where it is very unclean, and try to avoid the patients who are infected with these viruses. So these are the main three things by which you can avoid these infections. Now, moving on to the chronic hepatitis, that is the hepatitis, the viruses which infect you and stay with you for lifelong. The two most important being the hepatitis B and hepatitis C. What happens is these viruses infect a person and will be present in the blood for lifelong. So how do these viruses come to us? How do we acquire these? Unlike hepatitis A and D, where the viruses spread through food and water, these viruses we get basically by blood transfusions. Blood transfusions, I mean to say the blood which has been not screened for these viruses. So this is the major route of infection. One is blood transfusion, second is sexual transmission. A person who is infected with this virus transmits to his or her sexual partner. The third one being, most importantly, from mother to child, especially during delivery. So these are the most three important ways by which a person will acquire hepatitis B or C. One is basically through the blood transfusion, the infected blood. Secondly, by the sexual contact. Thirdly, by the infected mother to the child. So, what are the other rare things by which you can acquire these infections? One is tattoo or acupuncture, sharing personal items such as toothbrushes, razors, nail cutters, and other things include sharing of IV drugs, that is drug abuse. Hepatitis C is the most common virus which spreads through IV drug abuse. Now, what are the symptoms? Basically, how do the patients present to a doctor? How do a person will come to know he or she has this hepatitis B or C? Unfortunately, majority of these patients are asymptomatic. That is, they do not have any symptoms. Majority of these are detected during voluntary blood donation camps, or a person, he or she, willing to undergo a surgery, person gets detected during that time. So that is the time when a person will come to know. Otherwise, what are the other rare symptoms by which these patients can present? The most important one being, again, the fatigue. Patient will have a lot of tiredness. Patient sometimes can have fever. Patient will not feel like working. So these are the symptoms by which these patients can present. But the most important way how these patients are detected is during routine blood checkups, or whenever a patient has gone to hospital to undergo some surgery. During that time, the patients get detected. Otherwise, majority of these patients are asymptomatic. So let me go through one by one. What is hepatitis B? Basically, it's a virus spread through the blood. So how many people are infected around the world? There are 2 billion people worldwide which have been infected with this virus, and approximately 10 lakh people die of this virus every year. Hepatitis B virus is at least 50 to 100 times more infectious than HIV. So this one must remember. The one good part is hepatitis B is preventable. It can be prevented by vaccination, and it is now compulsory according to the Indian Association of Pediatrics to vaccinate all the children with 3 doses of hepatitis B vaccine. So the dosage includes, one is given at a 0 month, second after 1 month, the last dose being after 6 months after the initial dose of vaccination. So it's a good thing that we can prevent this hepatitis B virus, but it is very highly infectious, one must remember. So what is the prevalence in India? Prevalence, I mean to say, out of 100 people, how many people have this hepatitis B virus? It ranges between 2 to 7%. That is, if you take 100 people, approximately 2 to 7 persons are infected with hepatitis B virus. So it's an alarming situation, but can be prevented through vaccinations. Now, what are the things which can happen with hepatitis B? The most important thing is the patient can go into cirrhosis. Most importantly, cirrhosis means it's a permanent, irreversible damage to the liver. Patients can go into this, and the one more related complication of hepatitis B is hepatocellular carcinoma. That means to say liver cancer. So hepatitis B virus is the most common virus which can cause hepatocellular carcinoma. So the Indian government as well as the Indian Association of Pediatrics has made it compulsory for everyone to take these vaccinations. Now moving on to hepatitis C. Again, how does this hepatitis C occur? Hepatitis C, again with the similar things, patients can get through sexual contact, second through the blood transfusion, and most importantly by sharing the IV needles or the contaminated needles or injections with which one person can transmit to the other person. So what is the prevalence? How does this hepatitis C is prevailing in our world? Basically, it is present worldwide. Most importantly, in the Western countries, it is present in a very high prevalence rate. Approximately 150 million people are chronically infected with hepatitis C virus. Most importantly, what I want to highlight here is hepatitis C virus was discovered in 1983. Before that, it was not discovered. Hence, we have people who have been transmitted, who have got this virus through blood transfusions because there was no routine check of this virus before 1983. And similarly, before any surgery, there was no routine check for this hepatitis C virus. Hence, majority of these patients have been infected before 1983. And approximately 350,000 people died of this virus every year. And most important thing is that hepatitis C virus is curable with the available treatment in the current scenario. And one more unfortunate part about this hepatitis C virus is it does not have a vaccination, and whenever we suspect that a patient has got pricked with hepatitis C virus, there is no post-exposure prophylaxis as with hepatitis B or HIV. So this is more unfortunate thing with hepatitis C virus. So what and all these hepatitis C virus can cause to us? Again, similarly, it can cause something known as hepatitis C, chronic hepatitis. It can cause cirrhosis of liver, and most importantly, it can cause again hepatocellular carcinoma, that is liver cancer. So this is the one thing I want to highlight. We have vaccination for hepatitis B, but we do not have vaccination for hepatitis C. What is the treatment for these patients? Basically, who are patients with hepatitis B, it exists in the body in two types. One is active type, one is inactive type. Whenever their patient is detected with hepatitis B, whenever you go for blood transfusion, or whenever you go voluntarily to give blood, or whenever you go to get a surgery done, if you are detected hepatitis B, there are certain blood tests which needs to be done. Most importantly, you need to get a liver function test and a ultrasound of the abdomen. Based on these two tests, we can tell whether you have an active infection or an inactive infection. Unfortunately, even if you have an active infection, you are absolutely asymptomatic. That means to say you will not have any symptoms even if you have an active disease. That is when you need to check this blood test. So, if you have active disease, again we need to further do certain blood tests to ascertain how much copies, that means to say how much virus is present in your body. If it is significantly high, you need to be treated. But initially when you do the smaller tests such as liver function test and ultrasound, if you don't find active infection, you need not do anything. You basically wait for 6 months and again repeat the blood test, and hence the cycle continues. Every 6 months you need to get the blood test done. But with hepatitis C virus, what we need to do is initially do a blood test and count. Count, I mean to say that how much hepatitis C virus is present in your body. Based on that, we initiate treatment. Hepatitis C virus has got 4 types. One is genotype 1, genotype 2, genotype 3 and genotype 4. If you have genotype 1 or genotype 4, it has to be given, the treatment is for 48 weeks. Whereas if you have genotype 2 and genotype 3, the treatment is for 24 weeks. And it is likely that you will get cured of hepatitis C virus if you have genotype 2 or 3. and the chances of getting cured by hepatitis C virus genotype 1 and 4 is just 40 to 50%. Hence, I conclude by telling that hepatitis is very common around us. We need to be very careful. The viral hepatitis, acute hepatitis, can be caused by hepatitis A and E, whereas chronic hepatitis can be caused by hepatitis B and C. So we need to be very careful and look for these things. Thank you so much. Thank you. I hope I have impressed upon you regarding viral hepatitis and look forward for the further videos. Thank you so much.